Hello guys, so let's talk about tooth morphology and dental anatomy knowledge for mock-ups like this or even your restorations. This is the Zircon modifier software with high-resolution intraoral scans for us to study anatomy on real patients as well. So let's start with the anterior teeth. We have an central incisor as an example. Look at the gingival zenith, which is the highest point of the gingival margin. We have the buccal cervical convexity and even the palatal as well, gingival papilla, and the mesial incisal angle is closer to 90 degrees, whereas the distal angle we have a slope. So they are different. Let's see this from the occlusal view. Now we have incisal edges and interproximal contact points, the palatal fossa leading us to the cingulum. We have marginal ridges as well, just like we have in the posterior teeth. Let's see this in the software with 3D anatomy. We have the contact points between these teeth, which are usually points and not areas like this. So this depends on the library of teeth that we are using on the software. Now, central incisors, as I said, they have the mesial incisal angle closer to be a right angle, so closer to 90 degrees. Take a look at the shapes of the root. It's a pretty much symmetric tooth, and the crown shapes are usually similar to the face shape. So patients with elongated faces, they have usually elongated central incisors. Now, mamelons can also exist, especially in younger patients. They are small bumps and rounded areas on the buccal surface at the incisal third. Now you are seeing the palatal fossa, and note the convexities from a lateral view. The teeth can be divided into root and crown, as you should know, and that's the CEJ. Note the CEJ is a little bit shallower in the interproximal areas. Take a look at this. Now let's see the lateral incisor, which has the root angled towards distal and palatal directions, with a convexity on the distal surface. Mesial angle, which is also closer to 90 degrees, and again a slope on the distal angle. So look at the curve of the distal surface, where we have an almost right angle in the mesial side. This tooth is inclined, don't forget about this. Now we have the lateral incisor from a palatal view as well, and sometimes we have more cingulum, sometimes less, depending on the patient. The lateral incisor is smaller than central incisors, and the root, as I said, is curved towards the distal and palatal directions. Let's see now the canine. So we have the canine having the tip of the cusp closer to the mesial side, not the distal side. So the distal side we have a slope as well. So take a look at this. This is the canine of the right side. So the canine of the right side has the cusp closer to the right side of your screen. Now we have the distal side having a longer curve. That's very common for canines. The canine has not just an incisal edge, it has a cusp tip and a buccal ridge separating the buccal surface into distal and mesial. Now let's see the premolars. So we have the premolars with a small difference which is very important. The first upper premolar has the buccal cusp longer than the palatal cusp, which doesn't happen for the second premolar. First, let's review the posterior teeth. So we have buccal cusps, triangular fossa, we have the main grooves being the central groove, the horizontal groove between mesial and distal areas, and we have the distal marginal ridges as well and mesial, and we have also the palatal groove and pit for the 6 in this case. Now for the premolars, again, the first premolar has a longer buccal cusp as compared to the palatal cusp. Take a look at this. This tooth always have 2 roots and 2 root canals, as we can see here in this image. The tip of the cusp can be closer to the center of the tooth or closer to the mesial contact as well, just like the canine. The second premolar, the buccal cusp and the palatal cusp have the same height. That's a difference from the first upper premolar. The second premolar has usually 1 root and 1 root canal, although it can have 2 root canals sometimes. Now we have the molars with the upper molars with 2 buccal roots and 1 palatal root. The 6 is more common to have 4 root canals. This is less common for the 7. Now we have the central grooves from mesial to distal, but then we also have the palatal groove leading to the palatal tip in the 6. Now those are the 2 buccal roots and the palatal root of the 6. Their location can vary from patient to patient. And if we look from an occlusal view, we are seeing now the carabelly cusp. The carabelly cusp is behind the mesial palatal cusp of the 6. Now take a look at this. The 6, the first molar, is larger and wider as compared to the 7 and the 8. The 7 and the 8, they have the central groove and even buccal grooves with developmental grooves, but they don't have the palatal groove like the 6. Now let's see all the teeth with the contact points and creating the very nice curve of Spee. If you don't remember the principles of occlusion, go back to the video of the principles of occlusion. I will make the link available on the top right corner of this screen. It will show up at some point. Now let's see all the teeth in the software, and we are going to see the occlusal surfaces of all of them. Please note that the incisal edges of the anterior teeth are in line with the buccal cusps of the posterior teeth. This is very important for you to plan your restorations and crowns. Let's start with the inferior teeth now. So we have the central incisor, and look how the lower central incisor is so much thinner than the upper central incisor. So the upper central incisor is actually interacting in the occlusion with the lower central incisor and the lower lateral incisor as well. Look at this. Now, please realize that the upper lateral incisor is a little bit more distal than the lower lateral incisor. The upper canine is a little bit more distal than the lower canine, and so on. The upper teeth are always a little bit more distal because they are wider than the lower teeth. And here we have the occlusion being created with axial loading and the principles of occlusion, including the curve of Spee. Now back to the central incisor. The lower central incisor has a very flat incisal edge with no slopes towards distal or mesial sides. Here we are seeing crowding and even calculus in the lingual surface, which is very common in this area. Now the contact between the central incisors would be like this, because they are both very flat, and the role of the incisors is of course to cut the food, also helping in the speech and so on. Now the lateral incisor has also a flat incisal edge, but with a small slope towards the distal side. So here is the lateral incisor with a frontal view, and we can see again a right angle for the mesial angle, but then going up towards the distal direction, slightly of course. So here for the lateral we don't have cingulum and palatal fossa proeminent, but here for the canine we have the cusp tip closer to the mesial contact point, just like the upper one. But this tip is also a little bit more lingual as compared to the long axis of this tooth. Now we have the root of this tooth with apex with tip curved towards the mesial sometimes. Very good, let's see the premolars now. And the premolars, they have a difference between them. The first premolar has an underdeveloped lingual cusp, whereas the second lower premolar has both cusps developed. Let's see this from an occlusal view. Now, not even the central groove, which connects mesial and distal sides, can be seen in the first premolar. Okay, let's see now the first premolar. So the lingual cusp is underdeveloped, and then we still have a concavity on the distal side for root and crown. Okay, especially at the CJ. Now for molars, then we have the 6 with the distal cusp. That's very important. It's an extra cusp of the 6 of the first lower molar. Now from an occlusal view, you can see the distal groove and the buccal groove. So those are two grooves on the occlusal surface at the buccal side, and then the lingual groove as well, just like the other molars. So that's the 6. Please realize that all the lower molars, they also have the mesial ridge a little bit more developed than the distal ridge, although they are similar. Look, the mesial ridge, we have even the triangular fossa and the triangular grooves as well. The crown of the 6 is wider and longer as compared to the 7 and the 8, as we can see here. Now, the first premolar, we have the 2 occlusal pits, so we can see the pits, and the second premolar, we can actually see the central groove connecting the pits from mesial to distal. Now, those are the contact points of this library. We can see that the contact points of posterior teeth are areas, whereas for anterior teeth, the contact points are actually points. So they are small points. Please realize that all the incisal edges are also in line with the buccal cusps, just like for the upper teeth. Now we can see this properly on the real patient with the intraoral scans, all those differences between the teeth that we are talking about. We can see gingival recession, including those cervical restorations in the lower 6 and the upper 7 of the left side. Even the lower 7 has a cervical resin restoration. We can see that. Please also realize that the buccal tips and the incisal edges are more translucent as compared to the cervical areas of the teeth. Look now the occlusal surface. So we have the stained grooves, the stained sulcus. Please realize that a sulcus is the depression containing the groove, which is the line in the middle. So the sulcus is a depression that looks like a valley, but then in the middle of this we have the groove, and the central groove is the one connecting mesial and distal occlusal pits usually. So we have those restorations on the occlusal pits, especially on the molars, because that's exactly where the caries usually happen. For the lowers, a very similar situation with more gingival recession, but then we can see that we have stained grooves and sulcus, including buccal pits of the lower first molars, the calculus on the anterior incisors, and then you would plan your dental treatment trying to replicate the original anatomy of the patient, regardless if you are planning a restoration with direct composite resin or crown or even a dental prosthesis. Those were the tips of today. If you guys liked, please hit the like button and see you guys on the next videos.